There are a number of different procedures and drugs on the market that can help patients lose weight. Today on Wellness with Wood, we're looking at a newer option. So joining us is Dr. Stephen Simmer with Corewell Health. Doctor, thank you for joining us.
Well, thank you for having me.
Tell us about TORE, what it stands for, and what it is.
Yeah, so TORE is T-O-R-E, so it's transoral outlet reduction. And it's a minimally invasive endoscopic procedure for people who have previously undergone gastric bypass surgery, but have found themselves regaining weight or hitting a weight loss plateau. So this is a procedure that's specifically for people who have undergone the Roux-en-Y gastric bypass surgery. And for those people who aren't familiar with that, what they do during that surgery is a surgeon will take a piece of the stomach and connect it to the small intestine, bypassing a big portion of the stomach, hence why it's called gastric bypass. And part of how that works is that food then comes into that small pouch. People feel full earlier, and they're able to kind of limit the weight, the amount of food that they eat. So it's a very effective surgery, but over time, its results can diminish. And part of the reason for that is that the stomach and the small intestine, where those connect, called the gastric outlet, it can expand and stretch. And so before, when food would come into that stomach, it would fill up that small stomach, people would feel full and stop eating. But now that it's stretched open, people eat, they don't feel that sense of fullness.
Yes.
And they keep eating and regain weight. And that's what the TORE procedure aims to correct.
So we call it a new procedure, but it's actually been around since about 2013. Why are we hearing about it now?
So yeah, it's been around since 2013, and since that time it's been extensively studied. Techniques have been refined to produce the optimal results. But we're talking about it now because it recently gained FDA approval. And so that means that insurances are starting to cover the cost of the procedure, whereas before people were forced to pay out of pocket.
How invasive is the procedure? What can patients expect?
Yeah, so it's performed in the hospital under anesthesia. And so the patient is asleep, but also being closely monitored. So we go in with a scope through the mouth, into the food pipe, and into that small stomach. And on the tip of that scope has a special suturing device. And we suture that gastric outlet and kind of tighten it and reduce it in size. So it's a completely endoscopic procedure. So there's no skin incisions, there's no scars, nothing like that.
Sounds like this is going to be a very good option for a lot of people out there. Who should consider this?
So the people that should consider this are people who have previously undergone gastric bypass surgery and have found they may have lost that sensation of feeling full soon after eating and have regained weight. And so this procedure can be performed alone or in conjunction with other modalities such as medications.
All right. Dr. Simmer, thank you so much for joining us.
Thank you so much for having me.